Hi there.
Hey.
Shannan, you have a flag behind you and I just have a kitchen.
Pascal.
Hello, hello. Okay, setting up the YouTube now. So we should be able to stream that. And as soon as I have the URL, I will paste the URL in the chat.
Hi.
Hey.
How's it going, Heather?
All right, how are you?
Hey, good to see you. It's been a while.
I know.
How's 211 keeping up with all the load?
They're doing really well. I think it's going okay. Yeah. It's really nice to have a contact with public health, so we're putting everything into that spreadsheet, and so we get answers that feel really timely for the public, which is really nice.
You guys are a victim of your own creation. You were so awesome during the PSPS. That was like the first thing they thought of, was getting you guys in with public health.
Oh, good. Yeah, I'm happy we can help. It's great. PSPS was good training for this situation.
Just want to let you know Kimberly Parker just joined.
Hello, Ryan. Welcome.
Thank you.
Kristin.
Thank you.
Hello, Ryan. Welcome. Kristin.
Thank you.
We're now live in broadcast mode, so everybody who registered can now join. And we will promptly start in 2 minutes. And thanks everybody for being here.
Thank you for having me.
Sure, that would be good.
Okay, let's start this Nevada County COVID-19 Town Hall. First, I'd like to thank all our participants for making time. I know that all you folks are really busy, so really happy that you all can make it, and thank you for answering some of the questions and concerns that Nevada County residents have. I see we have 132 people that have joined us, and it also broadcast live on YouTube. So we will start with some introductions. I would love for people the agencies to tell us where they're at, what they're doing, and then we will get to the questions from the audience and the ones we receive ahead of time. So anybody wants to start? Okay, let's start this Nevada County COVID-19 town hall. First, I'd like to thank all our participants for making time. I know that all you folks are really busy, so really happy that you all can make it, and thank you for answering some of the questions and concerns that Nevada County residents have. I see we have 132 people that have joined us, and it's also broadcast live on YouTube. So we will start with some introductions. I would love for people to tell us where they're at, what they're doing, and then we will get to the questions from the audience and the ones we received ahead of time. So anybody wants to start?
Hi, Pascal. It's Ken Cutler at the Health Department. Would you like
Yes,
me to
please.
start with a few comments?
Please do.
Okay, I'm sorry, I couldn't hear in the background. So I'll just take a few minutes. I'm Dr. Ken Cutler. I'm the Public Health Officer in Nevada County. And I wanted to thank Pascal for hosting. Thank you all for tuning in to the virtual town hall to talk about the COVID-19 pandemic. It's 3 months ago, no one had heard of the virus SARS-CoV-2 that causes the disease COVID-19. But now globally, there have been nearly 500,000 people with confirmed cases in over 200 countries. In the US, we've now had 60,000 people who have had lab confirmed COVID-19, and unfortunately just crossed the 1,000 death milestone tragically. In California, cases are rising, now over 3,000 and over 60 deaths. One area of concern is that community-acquired transmission is increasing. We earlier had seen people have COVID-19 infections after travel, but now we're seeing it spread through the community, meaning that people who are identified with the infections don't have a travel history and don't have a known contact with somebody with COVID-19. Closer to home in Nevada County, we've reported that we have 7 residents who have tested positive for COVID-19. 2 of them appear to have had the infection from international travel. 4 have been community acquired. We can, I think, very safely assume that there are many other people out there with the infection that have not yet been detected because we know that testing has been really limited, and I'll talk about that a little bit further. But I want to be really clear that we do have some evidence of community transmission. That's not to cause people to panic, but for people to take action. And I want everybody to take social distancing, keeping apart from others, extremely seriously. That is our most important tool. It's our greatest tool to limit exposure in our community and decrease the number of people who get exposed to the virus, and therefore the number who get infected and have serious outcomes. Just to be aware, now that many of us have isolated at home or stayed at home, except for essential services, it could take weeks to see the effect of that because some people have already been exposed, and then it takes time for symptoms to develop and some time after that for potential complications. As you've heard, fortunately, if you do get sick, most people, about 80%, are felt that they'll have either mild or moderate disease or maybe even no symptoms. That means, though, that people in the community could have coronavirus but not know it and unwittingly spread it to others. That's their coworkers, their friends, neighbors, family. So it's really imperative to heed the governor's order to stay at home. It is safer at home. It will help spread the disease in our community. And our primary goal is to protect those in our community and also to keep our healthcare system from being overwhelmed so they can take care of people who need it most. I just want to remind people that we have a population in Nevada County of about 100,000 people and only about 129 hospital beds. You'll hear more about that later, I think, from the hospitals. But the hospitals are taking big action to try to increase their capacity, to take care of more people with more illness. But there are limitations on that. So we each have to do our part to limit the spread and slow the rapid rise in cases that we're seeing. We also know that our community is particularly vulnerable because we are older, and older folks have not done well with the virus, and those with underlying medical conditions as well. About 28% of our residents are 65 and older, and we also have a number of community members who are in skilled nursing facilities and assisted living facilities. And so we've taken extra precautions to try to work with them. We've actually hired a very experienced public health official, a physician, to reach out to those facilities individually and work with them on their plans. A note on testing. This has been an area of confusion and frustration for many, as you're hearing different stories from different levels of government and various sources. Testing is not available for everyone who wants it or who has fever and cough. I wish it was. Testing is ordered by your licensed healthcare professional who's making determinations based on their knowledge of you and your health and what's available. And these are difficult and hard decisions for them to make. Right now, they have some guidance from California Department of Public Health on how to prioritize the testing that is available. I want you to know that in general, people with mild respiratory symptoms who do not otherwise need medical care can be at home and may not need routine testing until it becomes universally available. If you have milder illness and your healthcare provider has said they can't offer testing at this time, the current recommendation for staying isolated at home and staying as far apart from other household contacts as you can is that you stay there until you have no fever and you have improved respiratory symptoms like cough for 3 days, and that it's been at least 7 days since your symptoms began. So please stay at home, stay calm, stay isolated as much as possible. We appreciate people staying informed. Misinformation we know spreads really fast. There are a lot of rumors about who does or does not have COVID-19 in the community. The Public Health Department, for privacy reasons, cannot comment on those. But we urge you to look for reliable sources of information. Please check mynevadacountry.com/coronavirus, California Department of Public Health website, Centers for Disease Control, etc. have lots of good resources. We appreciate working with our community partners. Connecting Point is a wonderful resource. You can dial 211. They are the best for questions and update on available resources and helping you manage non-emergency challenges. And I'll just finish by saying, please let your compassion, your goodwill for others guide your actions. And I appreciate the time and I look forward to answering the questions. Thank you.
Thank you, Dr. Cutler. And maybe could we hear from our county CEO, Alison Lehman, on what's the general situation with Nevada County right now?
Yeah, absolutely. Thank you, Dr. Cutler, for all your work, and thank you, Pascal, for putting this forum together. We've really seen our community step up and take precautions to help protect our community against coronavirus, and we truly thank you. I want to go over the key functions of Nevada County during this health crisis. Number one, you just heard from Dr. Cutler, and it's our public health department that leads the response to protect our community. But this is also in partnership with our local and state and health professionals and our hospitals. Secondly, we have our Office of Emergency Services, and you're going to be hearing from Lieutenant Jakobs. We have activated our EOC, and we're working closely with our first responders, our cities, our town, our schools, and local jurisdictions to have a coordinated approach to meet the service and supply demands. And then our third area is our community communication. And we know right now it is critical to get as much information out there quickly. And we do have a commitment to provide the most up-to-date information along with community services. And then fourth, we are responding to federal and state relief as quickly and as aggressively as we can. And this includes the local support for businesses. Our Board of Supervisors are advocating hard for local relief, and they're actively working to capture every dollar that becomes available to our residents and our community and businesses. And then lastly, we recognize the need to maintain essential services such as law enforcement, wastewater, social services, and behavioral health programs. And during this time, these services can't stop. And we're working to maintain a high level of county services by implementing teleworking with our employees. We're working in shifts to maintain the social distancing. We're maintaining our field operations while also putting the health and safety of our employees and residents first. So you will see today that our roads crews are still out there working, maintaining roads, bringing the roadways of snow and fallen trees, making repairs. Our wastewater collection and operations staff are continuing necessary services to keep sewer lines and plants operational. And the county and the Board of Supervisors, we see our construction industry being essential. And our community development agency is responding by maintaining services, by construction projects, proceeding with our engineers, continuing to work with contractors. We've implemented a drop and pickup box at the Root Center where you could continue the permitting process if you cannot do it electronically. And our building inspections are still occurring, but staff are practicing social distancing and following the guidance of our public health officials. But I really want to talk about our social services needs and our staff that are working to look at these community priorities. We're processing new applications for Medi-Cal and food assistance, and we have really seen an influx of applications for programs, especially in Medi-Cal. So we have made available almost all services over the phone and through our See for Yourself website. So although our Brighton Greens location in Grass Valley is closed to the public, the Root Center Social Services Lobby is open, but for only those individuals that cannot access services over the phone or by web. So we're conducting approximately 40 interviews a day of new applications. We're calling new applicants within 2 days. And so as that demand increases, we ask the community to be patient. And then for our county employees who are unable to do their traditional duties or their service areas, the volumes have declined. They're now assigned to be a disaster service worker through our Office of Emergency Services. So these employees are assigned to work and support the efforts of our nonprofits and our community partners. And I just want to take this opportunity to thank our community partners from Hospitality House to the Food Bank, Interfaith Food Ministry, and all the residents that are filling in the gaps, watching out for their neighbors, distributing free pet food, the teachers that are going to social media to read books to kids and are really jumping in wholeheartedly to the distant learning. And I'm really proud of our community, and I think our community is really going to rally, especially in times of crisis. And I just want to, with a final thought, and is that the county really understands how extremely difficult these times are. And there's a lot of uncertainty, and information truly changes by the minute. And as a mom, I know firsthand that families are having in terms of jumping into homeschooling and canceling sports seasons and talking to the kids about really what does this mean. And we all live in a small community, and we're connected to our local businesses. And we personally know people who are closing shops and laying off and are truly struggling. And as your local government, we're not only committed to continuing to provide services, but we want to do everything we can to support our community through this. we understand that this is going to be a massive financial burden on our local businesses and on our communities and our families. The Board of Supervisors has initiated a business task force, and it's being led by Dardick, who is on the forum today. And I'm hoping that I could do a warm handoff to him where he could talk about the resources that are coming available for our businesses and our residents, as well as the work that he's doing with our cities and our local partners. So thank you.
All right, thank you, Alison, and thank you, Pascal and Ubinet, for hosting this important town hall. And if I could just remind people on the call to go on mute just so that we don't have the background noise, that would be a big help. As Alison said, and I think everyone knows now, this is really an unprecedented situation. We find ourselves in the midst of a global pandemic where what's happening in our local economy is being reflected in every town across the world. And so I really applaud the Board of Supervisors and Alison for convening a task force and bringing all of us together to share resources and unite to protect our local economy. The task force is about 65 organizations who are helping with what we're calling our emergency economic response. These are people who have a great deal of reach in their own memberships, groups like the Chamber of Commerce, merchant associations, nonprofits like this, organizations and associations like the Center for Nonprofit Leadership, as well as the mayors, vice mayors, city managers of Grass Valley, Nevada City, and Truckee, all of us working county-wide to quickly distribute information, resources, and hear what people need from one another. This is effective two-way communication. There's so much information as Alison has come in, and especially now with the decision, the pending legislation from Washington, we want to be in a position where we can get information out, applications, best practices, how people can be successful. We saw with the SBA loans when we got the disaster assistance loans in place, and Kristin York from the SBC will talk about this more. There were literally hundreds of thousands of applications totaling over $30 billion, but many people didn't understand how to fill out the forms and what their eligibility was. So one of the things we're doing is hosting webinars, including one today with the Sierra Business Council, focused on small businesses and how to be effective in managing your business. So we are setting up other webinars for different sectors. We'll have one tomorrow focused on the retail food industry. Next week, we will have them focused on agriculture, construction, and other important sectors of our economy, bringing together leading staff as well as community members and leaders in the industry to share information and get it out to the people who need it the most. All of these business resources are being posted online. My Nevada County is obviously the clearinghouse /coronavirus business resources. So I would encourage you to check out that website, and for those who want to know about today's call, it's at 2 o'clock, so shortly after this one, preparing for the next new normal, and links are on that website. Again, mynevadacounty.com/coronavirus business resources. We're creating other ways for people to stay informed, not just the task force, but any business, any interested person can go to that website and sign up for a mailing list, and we'll be getting out that information to anyone who wants it. We're also using social media and have created a group on Facebook called Collaborative Resources for Nevada County Businesses. We have made that public to maximize the number of people who can engage. And finally, we want to hear from you. What do you think is most needed? What do you need from local government? What do you need from state and federal government that we can get to you? And email me directly. My name is Caleb Dardick. My email is Caleb, CALEB.Dardick, DARDICK @co.nevada.ca.us. Thank you. And I look forward to all of us working together to get through this and, restore our economy back to what it was, if not better, when we get through this.
That's great. And we'll also have Rem Scherzinger from NID on this call. And Rem, can you tell us a little bit about, first of all, is the water safe? And second of all, is there going to be water for us?
Am I there?
Yes, you are.
All right. Good morning, everyone. It's my pleasure to let everybody know that yes, the water is safe. We have been in contact with CDC and US EPA, and we are aware, or we know, that the coronavirus is that through our treatment process we can kill the virus in our treatment train by chlorination. So the water systems are safe. With regard to will we have water for the year, we have enough water in storage currently and have declared surplus in our WHO committee, so we're ready to deliver. So I think we can say for the process trains, yes, the water is safe. With regard to NID and its posture as we move into this pandemic, right now, NID is in a heightened state of operation. We have opened our incident command center, and we're working with OES in Placer County, Nevada County, and Yuba County, because we have water systems in all 3 counties. And we're also in the process of moving essential personnel out to our remote facilities to keep them there to enhance our distancing. With regard to our headquarters office, we have closed the headquarters office to the public, but we are still maintaining our customer service center. So we're taking calls, we're taking deposits. And then also we have our Paymentus program, our system is now in place so people can pay online. With regard to the question about will we be bringing the irrigation system online on time, the answer is yes. So we anticipate being fully operational by April 15th. Crews are currently in the field preparing those systems and ready for that operation. The only thing that we have closed to the public currently, other than our headquarters office, is recreation. All of our recreation facilities are closed to the public at this point in time. We anticipate opening them up for full operation on May the 23rd.
And speaking of those recreation facilities, does that mean that people can't walk on the trails around the lake?
No, it does not mean that. So it just means that they don't have access to our facilities. So the trails that folks have been using regularly, they're still open and available to the public. It just means, and if you can find your way, if people can find their way down to a lake, which we know they can kayak on those lakes. It just means that our facilities are closed.
Okay, thank you very much, Rem. And speaking of facilities that are closed and people staying home, how about we hear from Sheriff Shannan Moon and see what NCSO and partner agencies are up to make sure that we're all safe.
Yeah, Pascal, thanks for putting this together. I think it's absolutely critical that we have accurate information, and that lends that feeling of safety of having that accuracy and being able to get us all together and push information. Super appreciative. The governor's order does come with some enforcement, but in Nevada County, with the law enforcement partners, and I, as we've been discussing this, clearly our first focus is on education and trying to quell some of the panic that comes out with an order like this. I've worked for the Sheriff's Office for 30 years, and this is the first time I've seen definitely an order from a governor talking about sheltering in place. So I think it's really important that the message is clear in that we're here to help educate this community, and we're here to help provide the information and really get people to understand how important it is to shelter in place. The order comes with some enforcement. It is a misdemeanor. We've been very fortunate in this community that people are heeding the order and they are sheltering in place. But if it gets to the point where either people don't, or if we start to see large social gathering issues, then we do have the alternative methods of enforcement, which are starting off with fines. Then it would get to a potential where we'd maybe file a case for our district attorney to maybe handle after the emergency is over, and then up into and including arrest. But that's not where we want to go. We want to provide the information, do what we can to assist this community, and recognizing when the community does heed that, we're all safer, including your very important and very committed public safety personnel and first responders, your cops, your deputy sheriffs, your dispatchers, your correctional officers, your fire, your EMS, and all those public health folks that are working in the hospitals, trying to provide health. You have that huge impact by sheltering in place and following those orders in trying to curb the stop the curve of this pandemic going out of control. Our deputies are patrolling the streets. Our animal control officers are still out and about. We are also heeding the social distancing. So we're trying to we're doing our phone reports when we can. We're making a lot of contacts on the phone with folks that are calling in. I've looked at some of the stats to see where we are since the order, and it's good to see that they haven't increased and they haven't decreased. So we really are very typical on where we were with crime data for the same exact couple of weeks in March in 2019. I think that's a good measurement on what we're seeing out in the community. So not a huge crime spree, and the deputy sheriffs, and I know the police officers that are out there. We're speaking with the law enforcement, executive leaders daily to making sure that we're all on the same page and see really how we can help each other out. The mission at the Sheriff's Office is to provide excellent service in partnership with our community. And partnership is I think, the most important thing to help us throughout this pandemic, with partners, not only just in law enforcement, but with our media, with definitely the hospitals, in the jail for me, and our executive team over there, our partnerships with our contract medical provider. Dr. Britton is our contract doctor. Him, speaking and us having that direct connection with Dr. Cutler, critically important for us as we have that care and custody of those folks in our correctional facilities. So, it's an opportunity for us to come together as a community. I definitely see us becoming stronger with our collaborations and our partnerships. But staying home is definitely the most effective way to help us in the first line response on how we provide a safer community for us here in Nevada County. So with that, again, thank you. I appreciate the time and Pascal and the folks at UBNet for putting this together so we can get that message out to the community. I appreciate it.
Thank you, Shannan. We're also pretty lucky that we have both Kimberly Parker and Brian Evans from Sierra Nevada Memorial Hospital, and I know that a lot of people want to hear what they have to say. So Kimberly, would you maybe give us a brief overview and then hand it off?
Can I ask Brian to go first? Is that okay?
Absolutely.
Okay. Can you guys hear me okay?
Fine.
Okay. Thank you, Pascal. I appreciate you putting this together. And I think it's actually a great way to talk about what's going on in the community and certainly the hospital. So I look forward to more of these in the future. I want to talk about a few things that are going on at the hospital. It's been a very, very busy time here, as all of you can imagine, I'm sure. Healthcare workers are scrambling all over the world, really, to get ready and take care of patients with COVID-19. So Dr. Cutler talked about a few things. I want to go back to testing, first of all. We'll talk about testing and preparation and our surge plan a little bit and a number of other things. But we've really been working a lot with the county. We've been working with Dr. Cutler quite a bit and other partners. And that's been very, very helpful for us to get some of that support. On the testing, so the testing issue in the United States has been rather complicated. There's been a lot of issues related to testing in the United States. And when you look at other parts of the world, testing has actually been more available in other countries in the world, including places like South Korea. but it is ramping up and testing is getting better. The capacity is improving and the turnaround times are getting better for testing in the United States. But I want to talk a little bit about how the testing works at the hospital and also in physician offices, in the emergency department, and in our drive-through clinic. So for hospitalized patients, we are testing folks that we believe may have COVID-19, and those tests are going to the County of Sacramento lab. And so those tests have been taking, on some occasions, we've been getting results in the same day. But in other cases, it's been taking multiple days and longer for actual inpatients on the hospital to get results back on COVID-19. So that's been challenging for us, and that's been due to capacity issues related to the county lab down in Sacramento. We are also testing folks that come into the emergency department and are discharged if we believe that COVID-19 is a suspect infection there. And some of those tests are going to the county, others are going to Quest labs, and then still others are going to a reference lab that we have in Utah. So every one of these labs has different capacities and turnaround times, and that's been a little bit challenging. Dignity Health, which is the system that we are affiliated with, is working on a lab test that we will have access to in Sacramento, and that should be same-day turnaround once that's up and running next week. So that should really help us quite a bit with our inpatients and our ER patients. So that's testing. We did set up a drive-through testing process because it was very clear that we needed to have a way to test individuals while limiting the exposure of COVID-19 patients to other people in the county and other community members and our staff. So we really wanted to get our arms around that. So a lot of hospitals have really wanted to get that up and running. I was very proud of our team at Sierra Nevada because we were one of the first hospitals really to be able to do this. And that was with the help of GVPD and Chief Gamelgard and others, and certainly with the county and Quest Labs. So we've done a number of different tests in the drive-through. I think we've probably had roughly between 75 and 100 tests in the drive-through at this point. Some of those patients have gotten their results back, and some are still waiting because of these turnaround issues that we've talked about. We'll probably do more drive-through testing in the future, but right now we really only want to test those individuals where it's going to make a clinical difference. If somebody is sick, but they can be home and they can be isolated from other people and not cause problems, they're not a healthcare worker, then what we're saying is those individuals should just stay home and not get tested. That may change later from an epidemiologic point of view, and Dr. Cutler may want to talk about this. We'd really like to test everybody as quickly as we possibly can, but we've got to limit the impact of that and also the amount of PPE that we're using to do the testing. So that's testing. On preparation, which is another huge issue, you know, my life right now is just preparing for COVID-19 at this hospital, and we've had no patients test positive so far at Sierra Nevada, but we know, just like Dr. Cutler said, that there is COVID-19 in the community, and we're assuming it's out there now, and I suspect we'll have positive cases in the hospital shortly. So we're really trying to make sure that we have the capacity to deal with that. We're seeing in other parts of the world that hospitals have been overwhelmed by the numbers of patients, and they've really had to scale up, both in terms of the beds that they have for individuals, where they're putting ICU patients, equipment like ventilators, PPE, but especially labor. So skilled labor like nurses, doctors, respiratory therapists, those types of folks are in very high demand. And the demand for their work here in Grass Valley is going to go up quite a bit over the next few weeks. So we've been preparing surge plans to deal with that. I saw in the comments one person was asking, how many ICU beds do we have? What does it look like if we have, you know, a lot more patients? So at our hospital, we have a 10-bed ICU. Under normal circumstances, we may have an average of around 2 patients that are actual ICU patients on a ventilator. So that would be a typical day pre-COVID-19. So to see a surge, you know, we have the beds always to go up to 10 ICU patients, which would be very unusual for Sierra Nevada under normal circumstances, but probably not unusual in this situation. We've been asked to be able to surge up 40% in terms of our capacity, and all hospitals in California have been asked to do that as well. We're definitely able to go up 40% from our baseline of 2 patients. That's not a problem. We could even go up 40% from our ICU capacity of 10 in terms of our physical space, and we have all kinds of other space in the hospital, square footage, where we could set up temporary ICU care and we have plenty of ventilators for that kind of a surge. But where we get into difficulty is labor, because in a rural community hospital, we can't just, manufacture more nurses and doctors. So we've got a lot of planning around how to deal with that labor requirement. We have the ability to move some of our nurses and doctors from areas where we're not doing certain things, not doing certain clinical activities, and bring them in to take care of patients that have respiratory problems from COVID and other problems. So a lot of planning around that, a lot of detail around that. We've been working on this every single day, all through the weekends, and many of the healthcare workers are working unbelievable hours. So I'm really appreciative for that and just inspired by what they've been able to do. On partnerships, we've been partnering with the county. Like I said, the school district has stepped up big time to help out our employees who are necessary employees and have childcare issues related to school closures. So Scott Lay actually really stepped up and provided us with some classrooms where we can take employees' children in these situations. And some teachers have volunteered to be part of that. So very happy about that. I want to talk about communication briefly. We've been on Facebook in a more deliberate way than in the past. We've been on KVMR, KNCO, certainly Ubinet, and I think this is a great forum. And we're also planning on having more daily updates to the Union newspaper. So that's kind of the main stuff we're doing. I can certainly open it up for questions at the end, or I'll take some of the questions on the chat. But, really appreciative to everybody stepping up and helping, people donating material, donating N95s. Some of the construction teams around town have donated masks. We've got one individual who's making face shields, actually. He just retooled his entire operation to make face shields for our employees, which is unbelievable because we were running short on those, actually. And then also the hand sanitizer. We have a gentleman who has converted his distillery into a manufacturing process for hand sanitizer, which is probably going to be available not just for the hospital, but others as well. So that's all I'll say for now. I don't want to take up everybody's time, but appreciate the opportunity.
Thank you. Kimberly, anything to add?
I just add a couple things. Our office continues to be open. We're running on a skeleton staff and safe distancing and all, but we are here, and I think that, again, I join Brian in saying there have been a lot of community partners that are being very generous. There's a lot of questions around homemade masks, and I will tell you that we are sending out something shortly that has a specific pattern and instructions, and asking that people that do want to make masks follow that information so that we are sure that the material and all is safe to use and all. So that's coming out in our e-blast later today. We are sending out e-blasts at least twice a week with updated information. I would just say if somebody's not on the e-blast list and would like to be, you can email me at kimberly.parker1@dignityhealth.org. Again, that's kimberlyparker.org@dignityhealth.org. And we will be sure to add that to you so you can receive communications. We have a video coming out shortly also that Brian just taped yesterday. And we encourage people when that video comes out, probably later today in an e-blast, to feel free to share that out. We want as many people in our community to get that information as can possibly, get it. And the other thing I'll just say is if people have questions, they can call our office 530-477-9700.
Okay, great, thank you. And we will post those URLs in the chat so that everybody can grab those. Next, could we possibly go to Kristin York from SBC to tell us a little bit about what we have going with businesses, and if Kristin is not available, then we could go to Heather, because Heather is with 211, and we got quite a few questions about people wanting to know how they could help out, because Nevada County people are very generous. This is a great community. And yeah, so Heather, what can you tell us?
Hello, can you hear me?
We can.
Okay, great. I'm Heather Heckler with Connecting Point. We're the home of the 211 program. So I just want to quickly say, if you are looking for information and assistance, non-emergency information, we are available 24/7 at 211 or 1-833, dial 211. Please don't use 911 if it's a non-emergency situation. Please use 211. We're working very closely with public health and with other community partners to make sure we have the most accurate, up-to-date information. So just want to shout out on that. In terms of volunteer opportunities, so Connecting Point is also the home of the Volunteer Hub. And we've been working closely with our Volunteer Hub partners to see which opportunities are actually available right now. So we've been collecting those, and they're up at our website at volunteerhub.connectingpoint.org. You can go to our front page there and you'll see there's a COVID-19 opportunities button. Go ahead and click there. We also have all of those in our featured opportunities. So Interfaith Food Ministry needs volunteers. If you go to our website, you'll kind of see what they need. It's really just a show up and help situation. Freed Center for Independent Living is actually looking for volunteers to assist with telephone reassurance. So they have a great program where you can actually, over the phone, talk to seniors, people with disabilities, people who are feeling isolated, and just provide an ear and some listening and some just some assistance over the phone. I think that's one of the things that a lot of us are feeling is isolated, and I think that's a great program to help people feel more connected. Sierra Roots is also looking for volunteers, and then we also have, as you can tell, a theme of this talk today is how creative our community is, and so we have some partner organizations who are coming up with great ideas that people can do from home. So Hospitality House is looking for a grant researcher. And I also just want to say, I know that licensed healthcare professionals are, there's a shortage, and if you are a retired licensed healthcare professional, the local disaster healthcare workers are looking for volunteers, and there's information on our website for that as well. Fire Safe Council is urging folks to get out there and use this time to clear your property and make sure that you're safe for fire season, and help your neighbors do that, of course, with good, safe social distancing. But this is a good time to help your neighbors clear for fire. So those are some of the things we have going on, Pascal. I hope that's helpful.
Absolutely, absolutely. Thank you, Heather. Kristin, are you ready to tell us a little bit about, because there's a lot of businesses here, there's a lot of small businesses, and I believe we all need help.
Yes, we all need help. So I'm Kristin York from the Small Business Development Center. So we do have 12 independent consultants that actually work in the western part of the county. Our phones have been ringing off the hook 7 days a week. So what we provide is free technical assistance to small businesses. That's any business with under 500 employees. So all of our businesses essentially. And those services can be anywhere from cash flow planning, emergency cash flow planning, business planning, how to return after this crisis. And most importantly, we are essentially a field office for the SBA right now. So we can help businesses apply for the economic injury loans. We've helped a number of those. We have learned a lot in the process, who's getting through, who's not. We'll be talking about that at the webinar at 2 o'clock. Essentially, these loans are for businesses that do not have access to other types of capital. So they don't have a line of credit, they don't have an extended banking relationship. If you are a small business and you have that, there are other programs coming out of the stimulus package, the Main Street line, that you will have access to extended funding. These are loans, not grants. I want to point out there is a recoverable loan that was announced this morning, and that is extremely complicated, so I don't want to get too into it, but essentially that loan is available to businesses who keep their payroll current, so they are not laying people off. And there's a huge process to go through that. The other question we're getting a lot is, I had to lay my employees off, I'm very concerned about them, or I am an independent contractor, or I'm self-employed. The extended unemployment benefits will apply to self-employed people and independent contractors as well as employees. And between that is administered at the state, but the feds have guaranteed an additional payment, and those benefits kick in immediately. No longer do you have to wait the 7 days. Another question that we are getting is, how do we save our Main Street businesses, our bricks and mortar? So the amount of creative solutions that we've heard from businesses, people processing orders inside, leaving them outside of their door for pickup for certain things, and on a minimal staff, that's been great. But the one thing I have to say about that is, we all know who the richest man in the world is, and that's the owner of Amazon. And this is a time when our communities really have to come together, and when those small businesses open, we need to go there. If it means cutting our budget because we have to buy less, that's okay. We're all going to get used to that. But it means going to our local shops, going to our local theater, going to our local restaurants and grocery stores, supporting them, because that is what is going to bring them back to recovery.
Great, thank you, Kristin.
Yeah.
We have quite a few questions that that came in that we're talking about what kind of federal aid that Nevada County can expect to see in the near future, and if any funds are received or have any funds been received, then who will receive the money, how is that being allocated? Who wants to take that one? Alison.
Yeah, so a lot of information are coming down right now, and I really appreciate the work of the business task force and the cohort. So as that information comes down from the feds and the state, the county will be applying for when it's competitive, as well as understanding how to redirect
if I send them to you.
Those allocations. So we'll be posting, and I can that right now in the chat box, that the will go to get those resources. And I apologize for some feedback. So in terms of the, which everyone should be following, that impacts all of our residents, is that the state action for mortgage relief. So we'll be posting information on the county website on that. And also there is state action for medical insurance relief. So the Senate is pushing forward a $2 trillion stimulus package, $150 billion that will be going out to county and local governments, and as well as $130 billion for hospitals and health providers. So the information is coming down fast, and we'll be sure to keep the community informed. And one of the drivers of establishing the business task force is to be able to have those personal conversations and to talk with our business and understand really where the community needs are at, so we could be responsive.
Great, thank you very much, Alison. If we could maybe switch to back to Heather for some of the questions about volunteering that came in. Is there some way that we citizens can help you? There are many of us ready to help, and also the community has many who cares. There's the central resource being 211, but what is the best way to contact you?
To contact 211?
Yeah.
Great question. So from your phone, you can just simply dial 211. We also have a free 800 number, so that's 1-833-DIAL-211. That's DIAL 211. So that will connect you, and 211 is available 24/7. We also have a website, 211connectingpoint.org, where you can find all of these resources, and we have been collecting a lot of community resources under the COVID-19 resources banner up at the top there. We also have a text feature where if you, we can provide updates on important information. If you want to text NC Corona to 797979. We will be doing texting occasionally on most important information of the day. But basically, there are a lot of ways to find us, but we have a really skilled call specialist available 24/7, local folks who've taken over 600 calls on coronavirus this month alone. And they're very connected to the information. And I'd also like to say we have a really close working relationship with public health, and the information flows both ways. So public health has been really great about listening to what people are asking about and providing information based on those needs.
Okay, thank you very much, Heather.
Thank you.
Some very practical questions came in. Are we allowed to go to the post office to retrieve mail packages? And are there any new procedures that we should be aware of about sending and receiving packages and mail? Many people in Nevada County receive notices in their mailbox and then go to the post office. Any best practices? That might be something for Dr. Cutler, maybe?
Yeah, hi. So it's Ken Cutler. So I think going back to basics, you want to do a lot of hand washing and disinfecting. Whether you're receiving a package at home, you can take the time, and general household disinfectants fortunately seem to be pretty effective against COVID. We have all seen that it can last for a period of time on different surfaces, less time on cardboard than on stainless steel. Being out in sunlight will help decrease the time that the virus is viable. But I think you want to check our environmental health website, which has a very long list of disinfectants out there and cleaners. If you do touch things like packages, be sure to wash your hands prior to touching your face. You do not want to touch your face, which we all do. It's an easy habit. If you monitor people are doing it 20 or so times an hour. We want to make sure that that's only with washed hands. So try to disinfect surfaces as best as possible, and then double your protection by making sure your hands are washed and don't touch your face. Hope that helps.
That definitely helps. Another question, a little bit in the same vein, being how many days are people contagious before showing symptoms, and how long does the virus now last on clothing? Does spraying Lysol help?
Right. Again, I would look at our environmental health site that has more specific answers on which agents to use and which things. In terms of transmission, so people are considered to be the most contagious while they have symptoms. The extent that people are contagious to others when they have no symptoms is not clear yet, or how long they're potentially contagious to others before they have symptoms. But when we're doing contact investigations, we're starting with when people have symptoms, because when people are coughing or sneezing, that's when droplets are expressed that have virus particles out there. And that's considered the primary driver of transmission at this point. And then I would go back to, if people are symptomatic, if they have fever, cough, sneezing, sore throat, they're asked to stay at home and stay away from others, the frequent hand washing, closed door, not sharing utensils, etc. And do that until the fever is gone for 3 days without using a Tylenol or Motrin type of medication. Your respiratory symptoms have improved for 3 days as well, and it's been at least 7 days since your symptoms began. That's not going to stop 100% of transmission, but that is the current guidance for isolating yourself should you have symptoms. Now, obviously, one of the things I wanted to add before is that if you're worsening, if your symptoms have gotten better and then worse again, your fever won't go away, your shortness of breath, of course, talk to your healthcare provider. And then if you have more urgent needs, that's when you would seek emergency room care. If you have crushing chest pain, real shortness of breath, severe lethargy, dehydration, those type of things. So.
Okay, thank you. Another question we have is, people are wanting to move. I'm supposed to move on April 1st. Is that still allowed because of the shelter-in-place order? I'm not sure what to do if it isn't. And also another question talking about short-term rentals, how they impact the community. So Ryan, maybe could you take maybe the being allowed to move question for people?
I can take a shot at it. I mean, certainly the recommendation would be to stay home if at all possible, and only go out if it's for essential reasons. So if somebody's having to move because they're losing their place of residence and they absolutely have to move, then I'd say they should probably proceed with that. If people are moving because they're just going to their vacation home, then that would not be recommended.
That is an easy one. We have the questions that for about businesses that either people that have their own business that it's at a complete standstill. So again, the resources that both Caleb and Kristin listed both in the chat windows, and we will post those as well on Ubernet as a reminder. And of course, they are on the Nevada County Coronavirus webpage. But there's also a question if from somebody who is self-employed, no employees, but is sharing offices with other people. So they have their own private office, but there is a shared entrance, etc. And the person happens to be a lawyer, and they want to know if they can go into their office, and if there is any chance for them to what they should be doing.
This is Caleb. I could take a shot at that. I've spent, ever since the governor's order and my email got attached to the local version, I've been fielding calls from people about what's an essential service. And the mantra is really the same. Stay at home. If you can work from home, do so. So the lawyers are not listed as an essential service. That'll be, you know, I think that depends probably on the court's issues, but in all seriousness, if this person can work from home, they should. I think obviously an individual office is safer than a group office. You have social distancing if you're the only one in there. So maybe I would turn to Dr. Cutler to add anything to that.
Right, so we are asking people to stay at home because we want those stable environments where you're not interacting with lots of new people. That just brings in increased chance for exposure. If you are in essential services and you need to be together, then we're asking people to take that social distancing really seriously. So for instance, at the health department, when we do get together as part of our departmental operations center to respond to this crisis, we have very few people in a large conference room. So we can maintain at least 6 feet apart. We try to email each other, we text each other, we try to have as few interactions as possible. We're constantly cleaning surfaces, we're constantly cleaning hands.
Great. Jumping to another health topic, and Dr. Evans, could you speak to any increased risk for people that are either vaping or vaping with marijuana? That is apparently a large concern.
Yeah, you know, Dr. Cutler might have other thoughts on this. Certainly, there's not going to be robust research about the effect of vaping and also coronavirus at this point in time. But I think what is clear is that coronavirus seems to affect patients with comorbidities more significantly. It certainly affects the elderly population more severely. So it goes to reason that if somebody has lung issues related to smoking, vaping, or other lung problems, it's probably not a good combination. I don't know that there's going to be a lot of evidence right now in the literature. I think this is one of those things where we're going to have to look backwards at some of the data to be able to figure out exactly what the main risk factors were. I know that in China we were seeing some significant effects in smokers in that population. I'm not sure if we've seen that in the United States yet, but I would just say that this is a point in time where everybody needs to take care of their health to the best extent possible. They need to make sure that they're eating healthy, they're getting sleep as able, they're getting exercise as able, not going to the gym, of course. But they really do need to take care of themselves. And it's up to all of us as a public health measure, not just for our own personal safety, but to make sure that we're as healthy as possible. And all of these social distancing things that Dr. Cutler and others have been talking about are so crucial, not just for ourselves, but for the hospital, because we really want to be in a position where we can effectively take care of all the patients that we get, regardless of their condition. And our ability to do that is really going to depend a lot on how much the public takes all these things very seriously, including their own personal health.
All right, great, thank you. Another question we have is, workers at pharmacy store and grocery stores, are there any tests set aside for them in Nevada County, because they are in such contact with so many people? Are there any plans for them being tested? And the person also adds, and thank all of them.
So hi, it's Ken Cutler. We don't have any specialized plans to test individuals working in retail. I do want to say thank you to all of them for providing essential services. People need food, people need products to go along. Protect yourself as best you can in terms of keeping distance within a store. Again, wiping down surfaces, washing your hands before you eat multiple times a day. If you are ill, you need to leave that environment. Have a mask if possible at that point, because the mask, if you're sick and coughing, can decrease the droplets going out and landing on surfaces. And then talk to your healthcare provider. And they're the ones who, with you, can determine if testing is needed based on your individual condition. So they'll take into account whether you do have underlying heart disease, lung disease, diabetes, et cetera, that Dr. Evans has talked about. So that's the answer there. One of the questions that came in is, don't we need wider testing availability to really have the data of how many people in the community actually have it? And I would like to emphasize, I would love to have that capacity. And in some of the countries mentioned before, South Korea, Singapore, et cetera, where they've had widespread testing, it has helped in their response. But the reality has been, even though things are getting better on a daily basis in terms of testing capacity, that there have been barriers to that. There have either been shortages of the swabs, shortages of the gowns needed, shortages of the masks, shortage of lab reagents to do it. And so that has not all come together well yet in the United States. A ton of energy is being put to that. I would love to see wider testing become available, so we'll have a better handle on it. But there are other ways that surveillance can be done, and you will be seeing studies out there where people will be looking at blood tests that people have taken to see how many people, even if they weren't diagnosed with COVID-19, have antibodies to it, to start to try to determine how widespread the infection actually is. So there are other ways of trying to get to that data without testing everybody now when we have shortages of protective equipment. So thanks.
Thank you. Lieutenant Jakobs, the EOC, can you briefly tell us what is the EOC and what are you doing right now?
Absolutely. First, thank you, Pascal, for giving me the opportunity to speak this afternoon with everybody who's tuning in. My name is Lieutenant Bob Jakobs. I work for the Sheriff's Office here in Nevada County, where I'm currently assigned to OES as the county's Emergency Operations Coordinator. Today, I want to speak a bit about the county's Emergency Operations Center and how we're operating to support the county's response to COVID-19. Nevada County's Emergency Operations Center was activated on Monday, March 16th in order to assist Nevada County Public Health Department in their response to COVID-19. Here at the EOC, we act as the fusion center for information relating to the county's emergency response. This is where we execute the functions of emergency management at a strategic level, and we ensure the continuity of operations here within the county. As it stands, we're sharing these responsibilities with the County Public Health Department's Operations Center, who is taking lead on the response efforts. With that, we're assisting them with inventory and logistical needs. We're also helping to fulfill resource requests not directly related to public health, things like personal protective equipment. We've been delivering PPEs to departments in both the Eastern and Western County. Currently, our Emergency Operations Center is in what we would call a virtual activation, which is why you don't see a bunch of TV screens like a war room behind me. I'm actually in my cubicle. The majority of my staff is actually now working from home, which is great for achieving the social distancing. This event's pretty unprecedented, which has required us to switch to non-traditional structure for our EOC team. Our section chiefs, they're working remotely here within the ROOD or at home. We're heavily leveraging a variety of communication technology solutions to keep up our situational awareness, things like these Zoom meetings, other Teams meetings, conference calls. We have daily electronic report outs with our teams and our county leadership, just to make sure that we're all staying on the same page and that we're keeping that common operating picture. Some of the other things that we do. I'm sorry, go ahead.
Would you also be helping out if, let's say, there would be issues in the food supply chain, and could you, if anybody wants to address, because there are concerns about if that our local food supply chain, is it secure for now, and if not, are you taking steps, and do you think it will continue to be, will food continue to be available?
So I'm certainly not the subject matter expert on food, but I can tell you that the county recently instituted a food and nutrition coordinator who is working with all of our nonprofits in that industry to make sure that those nonprofits have what they need, whether it's food supply or the distribution capability. At this point, it appears that we're stable in Nevada County as far as the food supply and the distribution network. In fact, the food bank just had their first drive-through distribution today out at the Seventh-day Adventist Church, and from what I can tell, it appears it was quite successful. But we're going to continue to monitor that situation, and if shortages do come up, we're embedded with them, so we'll be able to respond to that immediately, whether that's a resource request outside of our county within the region, as far up as Cal OES. We have a number of options that we've got on the table as far as backfilling for the distribution efforts. If the food bank runs short on volunteers, like our CEO mentioned, we have a disaster service worker program here at the county. We could pitch in disaster service workers to assist. I know that right now they're relying heavily on Volunteer Hub for their volunteers. If both of those were to be tapped, we can reach up to the state. California Conservation Corps, part of their mission is to do things just like work in warehouses, food distribution. And if necessary, if we had to, we could also reach out to the state for the assistance of the National Guard. A little less than 200 National Guardsmen have already been deployed throughout the state to assist with efforts just like that. So we do have a number of options on the table, and that is one of the things that we're monitoring close because it's such a critical community need.
Thank you. This might be a good time as well to address some of the normal behaviors that we can, well, what is now considered normal. When you go out shopping, do our public health specialists recommend that people actually wear PPEs besides the social distancing? And is there anything that they should or should not do?
Hi, it's Ken Cutler. I'll try to answer that. So if you can avoid going out shopping, if you have a risk factor for having more severe disease, if you're older, heart disease, lung disease, diabetes, and somebody who's younger without those risk factors can shop for you and drop things off at the front door, and then you can disinfect them, take them in. That's preferable than going out. If you do go out, please don't go out if you're sick at all, and certainly avoid being with other people. So you'll notice at some of the stores, they'll only allow certain numbers of people in at a time so that distance can be maintained of 6 feet or more between each other, both when you enter and during checkout. And so try not to go during crowded times and maintain that distance. And then it's back to the basics, keeping those hands clean as soon as you get home or before entering the car, etc.
And what about people that are have family members that are coming from the quote-unquote hotspots like Washington State or New York? Are there any recommendations, and should people avoid to have family actually come home right now?
Yes, that is part of the stay at residence order through the governor, is that travel, except for essential functions, shouldn't be happening because you can be bringing unwittingly COVID-19 into a household. And now if somebody is coming home to support a family member in need, then they should be monitoring themselves as closely as possible, maintaining their distance as best as possible. But there are so many areas in the country that I don't think we can just point to Seattle or Santa Clara anymore. I think we have to realize that so many people in our environments could be having COVID-19, if not now, down the road. And so you will have to take those precautions and have as stable a living environment as possible without new people entering it, and then taking those steps at home to disinfect and keep clean and keep apart.
A little bit in the same vein, what about food from takeout food? Should people be concerned that somebody preparing the food could potentially be a carrier, and what should be done?
So most of the transmission is not felt that it's going to be picked up from the environment. It's potential. Most of it is going to be from person to person and close contact. But again, to be very cautious, if you can disinfect the container, transfer it onto a clean plate, not sharing utensils or plates with others, and cleaning your hands prior to eating, that should help. So even if there were a potential virus on the container, if you were to disinfect it and then clean your hands prior to eating, you shouldn't be transferring that to yourself.
Great, thank you. We have 15 minutes left in this town hall. There are quite a few questions that have to do with the hospital, but they're very specific. So again, I'd like to remind people that we cannot give medical advice here. That's not how it works. And but maybe Brian, if you could address if Sierra Nevada Memorial Hospital, are you working with other providers in Nevada County, either by supporting them or bringing them in right now so that you are fully staffed and fully equipped?
Yeah, so we're definitely working with the other providers in our community, physicians, nurse practitioners, and other skilled professional people to figure out how we can buff up our resources for a surge of patients. And we're also communicating with our medical staff offices about testing and who to test, how to test those individuals. The other thing that's helpful is that we're part of a hospital system, and there's 5 other hospitals in our division in Sacramento, Woodland, Folsom, et cetera. So we're working with those hospitals to try to make sure that we're learning from one another and getting ready in a very uniform way. And we're sharing supplies in some cases for things that, maybe we're a little short on a supply. So we've gotten some things from Folsom. We've shared supplies in that way. So I think this is really a collaborative effort. I did realize I wanted to mention a couple other things while I've got you on the line here. One is about visitors. We've changed our visitor policy in the hospital a couple of times now as a result of this. Just about every other hospital in the country has done that as well. And the idea is to limit the number of people that are coming on campus in general, but still allow for some visitation when necessary. And we're sort of trying to make sure that that's done thoughtfully and reasonably. We are asking every person who comes on campus whether they have any symptoms of any concern, significant travel history, and we're asking folks not to be on campus in those situations. And then we're limiting to 1 visitor for just some of the patients. For example, in the maternity area, we certainly want birth partners to be able to participate in that. If there's a comfort care situation, then visitation is allowed. But we're doing a lot of restriction now because it's necessary to protect not only the public, but our own employees and the patients so that we can really limit the spread of this. We've also done, we've essentially postponed or canceled elective procedures at the hospital. And that's something that virtually every other hospital in the country is doing now as well. It's been something that has been done in some cases voluntarily, but now it's become more of a requirement. And I think that's important because we need to preserve not only the labor around that, but also the PPE, the personal protective equipment we've talked about. And so if something can wait for a few months, then what we're doing is we're waiting. And we're reviewing all those cases on a daily basis with physicians and nurses to make sure that we're not canceling things that really do need to happen and within a short time frame. So lots of changes. We're continuing to look at this every single day, and more to come.
Thank you.
Pascal, it's Ken Cutler. Can I add on to that as well? So not only is the hospital limiting visitors, but it's very important that our skilled nursing facilities have really been restrictive on people coming in. And I know that's difficult. Many of us have loved ones in skilled nursing facilities, but we have seen tragically in other states that should someone get infected with COVID-19 in that setting, we have a lot of vulnerable people in close quarters together, and it can have tragic outcomes. So I know it's hard not to visit your loved ones in skilled nursing facilities. We want to keep that physical distance. Hopefully we can still socially connect with them through other means. And so skilled nursing facility staff have been trying to have Skype and FaceTime and other avenues for you to interact with your family member there. So, but it's very important to stay away from physical contact if you can in those situations. Thanks.
Thank you. Speaking of gatherings and meetings, government agencies have switched to a new, I don't know if it's improved, but it's a new way of conducting government meetings, and there have been some concerns about the ability of the public to participate in public meetings like the board of supervisors, planning commissions, etc. What's Nevada County doing, and what are the plans to ensure public participation?
So I'll go ahead and take that. This is Alison, Lehman, County CEO. So the governor did have a directive that he is having Brown Act guidance or revisions. So essential county or local government business could continue to move forward. With that being said, that now we're challenged with how do we get that public engagement, the public participation, which is so critical to our government process. So the Board of Supervisors had their first remote meeting, which was last Tuesday, using a platform of Teams. We took public comment through emails, phone, as well as e-comments, which is connected through the Teams product or the Granicus product of the county. We looked at videoing or streaming live the meetings. And moving forward to future meetings, we're really pushing out to our traditional media outlets as well as social media to get the questions, to get the concerns of the items that are moving forward with the Board of Supervisors. The agendas are posted the Thursday before of each Tuesday meeting. Our next meeting is going to be April 24th. April 14th. And so we want the public to look at the items coming forward and be proactive in sending us your comments.
And are there any plans for, let's say, public hearings on large items that have a lot of community interest, like the outdoor event ordinance, if that is being revisited? Are there any plans to push those public hearings until in-person hearings can be held, or will you keep to the deadlines?
So it's a balance, right? So we definitely, with items that we know are going to have a lot of public participation, we will put off. And then we're also sensitive to the items that have big community impact that need to move forward. So we'll be working with the chair, who has a discretion over the agenda, and making those decisions.
Great. We have the questions that are in the Q&A session. Thank you to the Nevada County Comms team for answering those questions as they come along. We'll have a wrap up of all the questions and all the great resources that our panelists have posted here in the chat window. We'll make that available to anybody. And I would like to invite the people that are on the call with us here to maybe answer the polling question that we just put up, because if there is interest from the public, we are happy to host meetings, weekly meetings that will be focused on one topic, be that food safety, be it volunteering, etc. And I am not going to force right now strong arm a commitment from our panelists, but I sure would appreciate it. If there are any last parting statements, anything that you would like our residents and everybody on this call, what is our biggest takeaway?
Well, I'll just start and say that for me, the biggest takeaway is that it's a great community to live in, and I'm so grateful to be part of it, because, you know, even though this is a very serious situation and it's frightening and it's anxiety provoking in so many ways, the silver lining for me is seeing so much support from the community, and it's just been, it's a beautiful thing to witness. And I do want to make sure people understand how important it is for them to take the public health's orders very seriously, because you will be helping us here at the hospital, you'll be helping yourselves, you'll be helping your entire community. I'm happy to be part of the ongoing town hall in the future. So you got my commitment there, Pascal.
Thank you very much.
And Pascal, this is Ken Cutler again. Thank you for the opportunity to get important information out. We want people to have reliable sources of information. And I want to echo what Dr. Evans says, is that even though we're asking people to do things that don't feel natural, to stay apart from close friends, from not having gatherings and getting together, with that physical distancing that's necessary to slow the spread of this dangerous virus, I'm hoping that people will still stay socially connected, socially united, and really band together despite being apart physically. So thank you.
Yeah, this is Caleb. I would like to add one thing too. I want to echo what Kristin said, that when this is over, let's really recommit to shopping locally. But right now, there are a number of people who are working in the service industry, at the pharmacies and grocery stores, and they are essential workers and they deserve your love and respect. You know, please don't get frustrated when they try to manage the number of people coming into the store. Many of the grocery stores are putting tape on the floor to sort of show you what 6 feet looks like. You shouldn't need tape. You know, create the space and be supportive and show your appreciation to these folks who are really exposed right now in a way that they probably never thought they were getting into. And so let's give them the love and respect they deserve.
I'll just build on what Caleb said. This is a really difficult time, but I'm an eternal optimist, and at the end of the day, we're all in this together. And I keep focusing on that moment in It's a Wonderful Life, where George Bailey is just handing out just what people need. We're all taking a hit, all of us. So just remember that, you know, no one's coming out of this clean, but if we hang together, we have a way better chance.
And I want to speak on behalf of all our local government agencies, our cities and county, that we have county and city staff that are working hard for our community every day to maintain those essential services. And we're really being proactive of looking forward and not only getting through this health crisis, but paying attention in terms of recovery efforts as well.
And with that, I would like to thank again all our panelists and everybody who attended this. We hope we answered some of your questions, and judging by our poll, we will have a weekly Zoom webinar on various subjects. We'll figure that out. In the meantime, please, if you can, stay home, stay safe, wash your hands, and be kind to each other.